Good evening to all of you. I am Dr. Sudhakar Rao, Chairman, Sushila Nethrology Group of Hospitals. Uh, at the outset, I convey my sincere thanks to AIOS as well as APOS for giving me this opportunity to address all of you. My topic is past, present and future, a practitioner's perspective. In practice as well as in academics for the past 40 years. I did my MS in 1983 and then started practicing as well as I was in faculty in Kurnool Medical College. So I got exposure for both practice as well as academics. Now, why I chosen this topic is every ophthalmologist who comes out of medical college, he will have a big dilemma to start a practice or to go for institutional practice or to join government service. My choice is private practice because in private practice you are the own boss. That's the greatest advantage. So there are no heads above you to question you. Then you can provide services which are not available in government stations. Most of the government institutions will have very less facilities. Even now we see many patients were seen with torchlights, not with street lamps. So definitely we can give a better service in private practice. Then third advantage is you will be practicing in your local area where you are born and brought up. So it is very lucky to serve our own people. And last but not least is of course money. More chair time, more money. So that is another advantage of private practice. I will divide my talk into three topics: past, present and future. I passed out from JIPMER in 1983 and joined as assistant professor. All these people are my colleagues at Kurnool. I started my clinic in 85 fag end in a small chamber, 4 into 6 feet, very small chamber, 200 rupees rent. I used to see 3-4 patients. Then I used to spend that money with my friends for tea and snacks. Then I used to operate in Dr. G. Chandrasekhar, you know, I think he is the director of LV Prasad Institute. His father's clinic is there, Balasubaya Eye Hospital. So I used to operate my cataract cases there and I used to get 100 rupees per case. Obviously it is intracapsular those days. What are the virtues of a practitioner? Hardworking, this is very important. You should not ask for working hours. The day when I started my work, I used to work from morning 7 to night 9 o'clock. Even at this age, I turned 67 now. I work from morning 9 to 9 p.m., 9 a.m. to 9 p.m. So there's no change in my working hours. Then we have to balance between our profession, communication skills, monetary management skills, and very important is family. So unless you balance all these things, it is very difficult to go through the life. And one other important where you have to concentrate is on non-clinical skills. Non-clinical skills means keeping your surroundings clean and aesthetic, and you have to try to do documentation at every level. And you have to be people's person because I have seen in my 40 years of journey, mouth-to-mouth publicity has got more value than any advertisements. You give a lot of mass media advertisements, but mouth-to-mouth publicity is the best. And whenever you start practice alone, you'll have a lot of stress. So you have to adapt to the stress. And some of the building blocks I noticed in practice building are, first is team building. When I started my practice in 85, no optometrists were available, no ophthalmic technicians. So we have to train people who are passed out from 10th or intermediate. We have to teach them how to do tonometry, how to do syringing, how to record vision. And we have to periodically check them also, they are doing properly or not. Then capital building. Once you start practice, you have to improve your practice, you have to do a lot of camps. Now both in rural areas, in towns, as well as in schools. So that is the only way by which you can become popular in that area. Then circle building, you have to be very friendly with all the practitioners practicing in your area, so that they will definitely they will send their cases to us. Our practice will improve. Then skill building, once you start practice, you have to fully competent enough to start the practice. You have to be familiar with all the branches of ophthalmology. In the middle of the practice, you cannot go out and practice. These are some of the camps which I attend. Every month we do 4 to 5 camps. Every week we do 4 camps. So in many of the camps I will be attending in this. Then these are my friends who supported me all these years. Then attending the CME programs like this is very essential, because to catch up with latest things, you have to attend all CME meetings wherever it is happening. Then roadblocks I come across are, one is time management. Initially when you sit in the OP, no patient will come, so you get lot of boring will be there. But you have to bear with that. Otherwise, over a period of time, all these hurdles will go away. Then machine management, you have to buy best equipment available in the market. This is very, very important. Best means all your results will be dependent on these machines. So if you pay peanuts, you will get monkeys. So you have to pay money and you have to get good equipment. Then you have to maintain the CMC and AMC also, because whenever a machine goes out of order, if you have not done CMC, you have to pay a lot of money for repair. Then fallacies in cash flow systems and medical recording. This is nicely answered by EMR. Once you start EMR, all these things, you can record all your patient data, accounting also will be done, and there is no chance of pilferage. So initially we were reluctant to start, especially my staff were reluctant to start, but with a lot of effort, we made them to do. Now everything is streamlined. Then all of us, when we practice, we should know at least a little knowledge about this labor laws, Consumer Protection Act, biomedical waste and pollution control. Present? From 16 to 4 clinic, I have now moved into 14,000 square feet super specialty eye hospital now. It nearly took 3 decades for me to achieve this. I got 6 specialists, all are super specialists, all are with fellowship. 2 cornea, 2 retina and 1 glaucoma and 1 oculoplasty. We do around 10,000 patients we'll see every month, and we do around 500 cases per month. I started a full-fledged refractive unit with Alcon Violet excimer laser. Recently we added photolasic also. After my brief training at LV Prasad Institute for phaco, at least only for 1 month, I bought this storage machine. Started my phacos those days, 20 years back. Now I moved to most sophisticated Alcon Centurion machine. 2 decades back, I was doing radial keratotomy operations for myopia using diamond knife, using this ultrasound pachymeter for corneal thickness. Now I have moved to most sophisticated Alcon Violet excimer laser with oculizer and topolizer, doing contour vision. So I have turned 67 this year. I have established a society called the Sai Education Society, through which we are doing a lot of free camps all over Rayalaseema. And we run a free OPD where we see 50 to 70 patients every day. I have 3 branches, one at Kurnool, one at Hyderabad. Recently we have started a branch at Nellore. We have started a fellowship also this year. We are taking medical retina 1 fellow, cornea and refractive 1, and glaucoma 1 fellow. We also give internship training for optometrists, especially this Vijayanagaram College. That Centurion University students, they come to our institution for 1 year training for internship. What is the secret mantra? There is no secret mantra in my practice. So as all of us know that Rome was not built in a day. You have to believe in yourself and focus on your goals. This is essential. Never shy to be wrong or back down from doing your work. I always found that average skills with good interpersonal and management skills definitely will outscore excellent skills with mediocrity in other fields. Non-negotiable stuff. I enjoy my morning walk with my dog Arrow, at least for 1 hour, which makes me fit. Since I am so busy in clinic, I have no time to spend with my children in the family. So I made my 2 children ophthalmologists. So now all of us sit in the ophthalmic hospital and we spend 24 hours in hospital only. My wife is my life. She is a gynecologist, but she was bearing with me and she was there with me throughout my journey. One more important thing I want to tell is whenever you see any patient who comes, you have to see as if you are seeing a kith and kin. That those dollar smiles, $1,000 smiles are more important than $1,000. My mentor, I always have my great inspiration for Professor G.N. Rao sir. Whatever I learned from him. So with his inspiration only, we are now starting academics into our practice. We're making an institution now. And we're also extending our services to Tier 3 cities where ophthalmic services are not really good. So we want to improve there. These are all G.N. Rao's ideas. This is the highest award we got, Scoach Award, National Award